Diabetes poses a specific risk to pregnant women and their baby. It's called gestational diabetes, and it's a form of type 2 diabetes. Dr. Kelly Leggett knows all about it. She specializes in obstetrics and gynecology at the Center for Women's Healthcare, and she's the Clinical Transformation Officer for Cone Health. Good morning.
Good morning. Thanks for having me.
Thanks for coming in. You know, this is something that every woman who has a child knows about, because you have to drink that drink and be tested just to make sure that it's safe for you and your baby, right?
That's right. We screen every woman at 28 weeks for gestational diabetes. And if you're high risk, so if you're overweight, Hispanic, have a history of a large baby in the past, we screen you twice. We screen you in the first trimester and then again at 28 weeks, just so we can catch that diabetes as soon as possible.
What types of risks are posed to a mom and her baby?
So when you have high blood sugars in pregnancy, it can lead to miscarriage, it can lead to birth defects, it can lead to very large babies, which can cause birth trauma, increase in cesarean sections. And in severe cases of extremes of sugars, it can even cause stillbirths or intrauterine fetal demise. For mom's health, it can predispose them to preeclampsia, which is that hypertensive disorder of pregnancy, and again cause birth trauma to the mom's baby and increase their risk for a C-section.
So what can you do if it turns out that, you know, a woman is diabetic, gestational diabetic?
So we keep them under really tight control. We ask them to take their sugars 4 times a day.
Oh, wow.
Fasting in the morning before you eat, and then 2 hours after each meal. And we need to see those values. And fortunately, we have a new technology that we're using called Baby Scripts. And this allows women to put their values into their phone, and I can see them right away. And also there's triggers that get alert if there's extreme highs or extreme lows. So I'm able to know what's going on with that mom even when she's at home.
So that protects the mom and the baby, you know, from those very highs or those deep lows too, and you can have their answers right there.
That's right. I can intervene. I can call them and make sure that they're okay. Are they having problems with their medication? Is their meter working correctly? And I can intervene in between appointments.
That's awesome. That's great use of technology there. So is it true that if a woman is diagnosed with gestational diabetes, that she's at a greater risk for type 2 diabetes later in life?
That's right. She has a 50% risk of getting type 2 diabetes at some point in her life. So these women, after their pregnancy is ended, they need to be screened for diabetes again at 6 weeks postpartum to make sure they aren't type 2 and make sure they have a primary care physician who keeps an eye on that.
And if they have gestational diabetes and they have another child, you're already there and have that, I guess, history so that you know what to do, right?
That's right. And that would be a woman that we screen early in that first trimester to make sure they're not already diabetic in that first trimester.
Awesome. And very interesting the way that technology has stepped up in recent years to help it out.
It is. We're trying to make healthcare more convenient for our patients, and this is a great way.
Absolutely. Very much so. All right, November is Diabetes Awareness Month. Did you know that? And you have a chance to watch a video by Donetta Floyd, who joined us on Monday. It's called Pre-Diabetes: How to Reduce the Risk of Developing Diabetes. It is online now at the Cone Health website. All you have to do is go to conehealth.com/wellness-on-demand. Also, you can find out more about classes and seminars and all kinds of things that are happening at Cone Health by going to conehealth.com/diabetes. Thank you so much for being here today.
Thanks for having me.
Great information.
House Call on Fox 8 is sponsored by Cone Health.